You're the temporary replacement? This is a level 3 trauma case. I need someone competent. Dr. Richard Thornton's voice cut through the preparation room like a scalpel through tissue. Victoria Ramirez looked up from the surgical chart she'd been studying, her dark eyes meeting his gaze without flinching. The early morning light filtering through the windows of San Diego Regional Military Medical Center cast long shadows across the sterile white floors. "I'm prepared, sir," Victoria said quietly, her voice carrying no defensiveness, no explanation. Just a simple statement of fact. Thornton laughed, but there was no humor in it. He was 52 years old with silver hair combed back perfectly, and glasses that probably cost more than Victoria's entire month's salary. His white coat was pristine, his posture imperial. "We'll see about that." He gestured toward the surgical instruments laid out on the steel tray. "This patient requires precision. One mistake could cost him his life. Do you understand what that means?" "Yes, sir. I understand completely." Victoria returned her attention to the chart. Her movements economical as she adjusted her surgical mask and tucked a stray strand of black hair back into the tight ponytail at the base of her neck. She'd been at this facility for 3 months now. Always the temporary replacement. Always on the periphery. That was exactly where she needed to be. Around her, the morning shift was beginning. Residents clustered near the coffee station, their voices low but carrying in the quiet space. Victoria caught fragments of their conversation without looking up. "That's the temp, right?" Dr. Myers, a second-year resident with perpetually tired eyes, took a long sip of coffee. "The one who never talks to anyone?" Dr. Park, standing beside him, nodded slowly. 3 months and I've never seen her at a single social event. Not even the mandatory ones. Maybe she's just shy. Nobody's that shy. Park's voice dropped lower. "And did you see those sutures she did yesterday on that MVA patient? Those knots weren't normal. They looked military." Victoria's hands didn't pause as she organized the surgical instruments. But something tightened in her chest. She'd been careful, so careful. But muscle memory was a difficult thing to suppress. 6 years of operating in field hospitals under enemy fire had carved certain patterns into her hands that civilian training couldn't erase. She pulled her sleeves down slightly, making sure the fabric covered her forearms completely. The small trident tattoo on her left arm remained hidden beneath the long-sleeved scrub top she always wore, even when everyone else switched to short sleeves in the California heat. "Dr. Ramirez." A new voice, softer than Thornton's. Victoria turned to find Nurse Captain Jessica Chen standing beside her, a tablet in her hands. Chen was 38, with short black hair and eyes that saw more than most people realized. "I pulled the pre-op labs you requested. Everything's ready for your case." "Thank you, Captain Chen." Their eyes met for a brief moment, and Victoria saw something flicker across Chen's expression. Recognition, perhaps, or curiosity. Chen had served 2 tours in Iraq as a field nurse before transitioning to this position. If anyone in this facility might recognize the signs, it would be her. "Those knots yesterday," Chen said quietly, her voice just loud enough for Victoria to hear. "I've only seen those tied that way in one place, in field hospitals. Afghanistan, specifically." Victoria's pulse quickened, but her face remained neutral. "I study extensively. Surgical technique journals, international methods." "Of course." Chen's tone was careful, professional. "It's just unusual to see such advanced techniques from someone listed as a temporary staff member from a mid-tier program." Before Victoria could respond, Thornton's voice boomed across the room. "Dr. Ramirez, we're needed in conference room B. Morning briefing in 2 minutes. Try to keep up." Victoria nodded and followed, but not before catching Chen's gaze one more time. The nurse's expression had shifted to something thoughtful, analytical. Victoria felt the first crack forming in the careful walls she'd built around her identity. The conference room was already filled with surgical staff when they arrived. Thornton took his position at the head of the table, his commanding presence immediately silencing the low conversations. Victoria found a seat in the back corner, as she always did, her posture straight but unobtrusive. "We have a full surgical schedule today," Thornton began, clicking through slides on the projection screen. 3 scheduled procedures and at least 2 trauma cases waiting in the queue. He paused on a slide showing a patient chart. This is our priority case. 45-year-old sergeant with acute cholecystitis. Standard gallbladder removal, but the patient has a complicated medical history. Victoria studied the information on the screen, her mind already processing the data. Something about the presentation pattern caught her attention. The timeline of symptoms, the specific location of pain, the patient's elevated white blood cell count combined with his recent deployment history. Dr. Park, you'll be assisting me on the vascular repair in OR1. Myers, you're handling the appendectomy in OR4. Thornton's finger moved across his tablet. And Dr. Ramirez, you'll take the cholecystectomy in OR3. It should be straightforward enough even for a temporary replacement. Try not to take more than 2 hours. Laughter rippled through the room, not quite cruel but dismissive. Victoria felt their eyes on her, measuring, judging. She'd felt the same looks for 3 months now, and before that, in other places, for other reasons. Being underestimated had become a familiar weight. Understood, sir, she said simply. The briefing continued for another 15 minutes, but Victoria's mind was already working through the cholecystectomy case. Something about the patient's presentation bothered her, a pattern she'd seen before in a very different context. In Ramadi, when she'd operated on soldiers who'd been exposed to contaminated conditions. When infections spread faster than protocols anticipated. After the briefing, she pulled the patient's full chart from the system, reading through every detail. Sergeant Davis, 45 years old, recently returned from a 6-month deployment. Abdominal pain for 48 hours, fever, elevated inflammatory markers, all consistent with gallbladder infection, but Dr. Ramirez? Victoria looked up to find Chen standing beside her workstation. The nurse's expression was carefully neutral, but her eyes were sharp. I noticed you requested the patient's deployment history. That's not typically part of a pre-op review for cholecystectomy. Sometimes deployment conditions affect presentation, Victoria said, keeping her voice level. Exposure to different pathogens, delayed medical care, environmental factors. Chen nodded slowly. That's true. Most civilian surgeons wouldn't think to check that, though. Most wouldn't know to look for those patterns. The words hung in the air between them, a question that wasn't quite asked. Victoria saved the chart and stood, gathering her surgical cap and mask. I should prepare for the procedure, she said. Of course. Chen stepped back, but her gaze never left Victoria's face. Just one more thing, Dr. Ramirez. When you reached for that scalpel yesterday during the MVA repair, your stance shifted. Military stance, weight distribution for rapid movement in unstable conditions. I recognize it because I used to stand the same way. Victoria's breath caught, but she forced herself to remain still. Old habits are hard to break. Yes, Chen agreed quietly. They are, especially the ones that kept us alive. Before Victoria could respond, the intercom crackled overhead. Dr. Ramirez to OR3 for surgical prep. Dr. Ramirez to OR3. Victoria moved toward the door, but Chen's voice stopped her once more. Whatever you're running from, whatever you're hiding, I hope it's worth it. Because talent like yours shouldn't be wasted on trying to disappear. Victoria didn't answer. She couldn't. Instead, she walked toward OR3, her mind racing through scenarios, possibilities, consequences. 3 months of careful anonymity, and now someone was asking questions. But there was a patient waiting, a case that didn't feel as straightforward as everyone else believed. And if Victoria had learned anything in 6 years of combat surgery, it was that instincts existed for a reason. The pattern she'd noticed in Sergeant Davis's chart, the subtle indicators that others missed, they meant something. As she scrubbed in, watching the water cascade over her hands, Victoria caught a glimpse of her reflection in the steel surface of the surgical sink. Dark eyes stared back at her. Eyes that had seen too much, had been forced to leave behind everything she'd worked for because of one impossible decision in Kandahar. She pulled on her surgical gloves, the familiar snap of latex against skin grounding her. In 90 minutes, she would prove whether her instincts were right, or whether 3 months of hiding had dulled the edge that had once made her one of the most skilled combat surgeons in the Navy. If you want to see how this underestimated surgeon proves everyone wrong when a Navy SEAL's life hangs in the balance, Make sure you subscribe to Emergency Heroes Stories. Where are you watching from? Because what happens in the next 9 minutes will leave the entire surgical team speechless. Victoria pushed through the OR doors, ready to face whatever waited on the other side. The residence lounge smelled like burnt coffee and exhaustion. Dr. Myers refilled his cup for the 3rd time that morning, his hand trembling slightly from too much caffeine and not enough sleep. Beside him, Dr. Park scrolled through her tablet, reviewing case notes, but her attention kept drifting to the surgical schedule displayed on the wall monitor. "Did you see the temp got assigned the cholecystectomy?" Myers took a long sip, grimacing at the bitter taste. Thornton basically handed her the easiest case on the board. Park looked up, her expression thoughtful. "I wouldn't say easiest. That sergeant has complicated deployment history. Plus his inflammatory markers are concerning. It's still just a gallbladder." Myers shook his head. "Thornton's testing her, seeing if she can handle basic procedures without supervision. Probably thinks she'll take 4 hours and need backup." A 3rd resident, Dr. Williams, joined them at the counter. His surgical cap was already on, ready for his own case in an hour. "You two talking about the ghost again?" "The ghost?" Park raised an eyebrow. "That's what some of the nurses call her." Williams poured himself coffee. 3 months here and nobody knows anything about her. No social media presence, doesn't attend any hospital events, shows up for her shifts and disappears immediately after. Like a ghost. Myers leaned against the counter. "I heard her medical school wasn't even ranked in the top 50. How'd she even get a position here? Temp or not?" "Maybe she knows someone," Williams suggested. "Military facilities sometimes have political appointments." Park wasn't convinced. "Those sutures yesterday, though. On the MVA patient with the complex laceration repair. I watched her work. Those weren't textbook techniques. They were field techniques, the kind you develop under pressure when resources are limited and time is critical." "Come on," Williams laughed. "You think she's got secret combat experience or something? She looks like she'd faint at the sight of real trauma. I'm just saying her hands moved differently." Park's voice dropped lower, and Nurse Chen was watching her too. "You know Chen served in Iraq, right? If anyone would recognize military medical training, it'd be her." The conversation paused as another resident entered, grabbing a granola bar from the vending machine. After he left, Myers spoke again, quieter this time. "Lucky guess on those sutures. Maybe she's been studying advanced techniques online. YouTube has everything these days. Nobody learns to tie military-grade knots from YouTube," Park insisted. "Those require muscle memory, repetition under actual field conditions. You can't fake that kind of precision." Before Myers could respond, the intercom crackled overhead, announcing Victoria's assignment to OR3. The 3 residents exchanged glances. "Well," Williams said, finishing his coffee, "I give it 2 hours before Thornton has to step in and take over. Basic cholecystectomy or not, she doesn't have the experience for solo work." Meanwhile, in the main surgical corridor, Victoria walked toward the staff conference room where Thornton had summoned the surgical team for morning rounds. Her steps were measured, economical, the kind of movement that covered ground efficiently without appearing rushed. Years of navigating field hospitals under fire had taught her that wasted motion could mean the difference between life and death. The conference room buzzed with pre-shift energy. Surgeons reviewed cases, nurses coordinated schedules, residents jockeyed for position near the attending physicians, who might offer valuable teaching opportunities. Victoria took her usual seat in the back corner, her tablet open to Sergeant Davis's chart. Thornton entered with his characteristic authority, silencing conversations with his mere presence. "Morning, team. We have critical cases today. Let's review assignments." He clicked through the presentation, detailing each surgery with clinical precision. When he reached Victoria's case, his tone shifted subtly, becoming almost dismissive. "Dr. Ramirez, you'll handle the cholecystectomy in OR3. Sergeant Davis, 45 years old, standard gallbladder inflammation. Should be straightforward enough." His eyes found hers across the room. "Try not to take more than 2 hours. We need the OR available for more complex cases." Scattered laughter rippled through the assembled staff. Victoria felt the weight of their low expectations, their assumption that she would struggle with even this routine procedure. She'd carried that weight before, in other places, and had learned to use it as armor rather than burden. Understood, sir. She kept her voice neutral, professional. Good. Thornton moved on to the next case, but not before adding, Dr. Park will be on standby in case you need assistance. We can't afford complications today. More laughter, quieter this time, but no less dismissive. Victoria's fingers tightened imperceptibly around her tablet, but her expression remained unchanged. Let them underestimate her. It made everything simpler. After the briefing, she returned to her workstation and pulled up Sergeant Davis's complete medical history. Standard protocol called for reviewing recent labs, imaging, and presenting symptoms. But Victoria went deeper, accessing deployment records, environmental exposure reports, medical care received in theater. Something was wrong. The pattern of symptoms didn't quite match typical cholecystitis. The timeline was off, the progression too aggressive for simple gallbladder inflammation. And that elevated white count, combined with the specific pattern of abdominal rigidity noted in the physical exam, triggered memories of cases she'd seen in Ramadi. Necrotizing fasciitis. The infection didn't start in the gallbladder. It started somewhere else, probably from a minor wound or exposure during deployment, and had been spreading slowly through fascial planes. If she opened him expecting simple cholecystitis and found active necrotizing infection instead, the entire surgical approach would need to change immediately. Dr. Ramirez? Victoria looked up to find Nurse Chen standing beside her, that same analytical expression from earlier. I pulled the additional labs you requested. Chen set down a tablet. The ones that aren't typically ordered for routine gallbladder cases. Thank you. Chen didn't leave. Instead, she pulled up a chair, her voice quiet enough that nearby staff couldn't overhear. You're looking at his deployment exposure history. Why? Deployment conditions affect presentation, Victoria said carefully. Different pathogens, delayed access to care, environmental factors that don't exist in civilian contexts. Most surgeons wouldn't think to check those details. Chen's eyes were sharp, evaluating. Most civilian surgeons don't know to look for those patterns. But someone with field experience, someone who's operated in theater, they would. Victoria met her gaze directly. I'm thorough in my reviews. That's all. Of course. Chen stood, but her expression suggested the conversation was far from over. Just be careful in there, Dr. Ramirez. If your instincts are telling you something's wrong, trust them. Field instincts don't lie. She walked away before Victoria could respond, leaving behind implications that hung in the air like smoke. How much had Chen noticed? How much had she guessed? And more importantly, how long before those observations reached Thornton or hospital administration? Victoria closed the deployment records and focused on the surgical plan. She had 47 minutes until OR prep began. 47 minutes to prepare for a procedure that everyone expected to be routine, but that every instinct she'd developed over 6 years of combat surgery was screaming would be anything but simple. She pulled up imaging studies again, examining the CT scan with fresh perspective. There, in the fascial planes adjacent to the gallbladder, subtle density changes that could be early tissue necrosis. The radiologist had noted them as artifact, but Victoria knew better. She'd seen this exact pattern in Afghanistan, in soldiers who'd been exposed to contaminated soil or water, who'd developed infections that spread silently until they became life-threatening. If she was right, opening for simple cholecystectomy would be catastrophic. If she was wrong, insisting on broader surgical exploration would waste time and resources, confirming everyone's doubts about her competence. But 6 years of field medicine had taught her one unshakable truth. When your gut says something's wrong, you don't ignore it. You prepare for the worst and hope for the best. Victoria began modifying her surgical instrument request, adding debridement tools and extended irrigation supplies. The OR staff would wonder why she needed equipment for complex tissue removal during a simple gallbladder case. Let them wonder. Better to have the tools ready than scramble for them mid-surgery. 23 minutes until OR prep. Victoria stood, gathered her materials, and walked toward the surgical wing. Behind her, she could feel eyes watching, judging, waiting for her to fail. She'd felt those eyes before, in other operating rooms, under very different circumstances. This time, she wouldn't let them down, even if they didn't know it yet. OR-3 was already prepped when Victoria pushed through the double doors. The surgical lights blazed overhead, casting everything in sharp relief. Sergeant Davis lay on the table, unconscious under anesthesia, his abdomen exposed and painted with antiseptic solution that gleamed orange under the lights. The anesthesiologist, Dr. Kumar, glanced up as Victoria entered. Patient is stable. Vitals are holding steady. BP 120/75, heart rate 68, oxygen saturation 99%. Victoria approached the table, her eyes scanning the monitors, the IV lines, the endotracheal tube maintaining Davis's airway. Everything looked routine, textbook, but her instincts screamed otherwise. Nurse Chen was already scrubbed in, standing beside the instrument tray. 2 surgical technicians flanked the table, ready to assist. All of them watched Victoria with barely concealed curiosity and doubt. "Dr. Ramirez," Chen said quietly, "I saw your modified instrument request. You added debridement tools and extended irrigation supplies. Care to explain?" Victoria positioned herself at the surgical field, her hands hovering over Davis's abdomen. Just being thorough. Better to have equipment ready than scramble mid-procedure. For a simple cholecystectomy, one of the techs couldn't hide the skepticism in his voice. Victoria didn't respond. Instead, she pressed her gloved fingers against Davis's abdomen, palpating with practiced precision. There, beneath the surface, she felt what the imaging had suggested but everyone else had missed. Subtle rigidity in the fascial planes, defensive tension that extended beyond what gallbladder inflammation alone would cause. Scalpel. Chen placed the number 10 blade in her palm. Victoria paused for one moment, that familiar pre-incision pause where everything narrowed to this single point of decision. 6 years of combat surgery had taught her that first incision mattered more than anything that came after. It set the tone, established the approach, determined outcomes. She made the cut. Clean, precise, following the natural lines of anatomy. The skin parted beneath the blade, subcutaneous tissue exposed. Blood welled immediately, but not excessively. Normal response, cautery, retractor. The instruments appeared in her hands with Chen's efficient timing. Victoria worked through the layers, each movement economical and purposeful. No wasted motion, no hesitation. This part was routine, the kind of surgical dissection any competent surgeon could perform. But then she reached the peritoneum, the thin membrane lining the abdominal cavity. And everything changed. The smell hit first. Not the typical scent of abdominal surgery, but something else. Something that made Chen's eyes widen above her mask. "That's not normal," Chen whispered. Victoria's jaw tightened. "No, it's not." She carefully opened the peritoneum, exposing the gallbladder and surrounding structures. What she saw confirmed her worst suspicions. The gallbladder itself showed inflammation, yes, but spreading from it, infiltrating through fascial planes, was unmistakable tissue necrosis. Necrotizing fasciitis. Victoria's voice was steady, despite the adrenaline now flooding her system. "This isn't simple cholecystitis. We've got active soft tissue infection spreading through multiple fascial planes." Dr. Kumar looked up from his monitors. "How bad?" Victoria extended her exploration, carefully dissecting to assess the full extent of damage. "Bad enough. This started days ago, probably from a minor abrasion or puncture wound during his deployment. The infection's been tracking silently through tissue layers. Should we call Dr. Thornton?" The surgical tech's voice carried undisguised panic. No time. Victoria was already working, her hands moving with sudden urgency but perfect control. "I need extended debridement kit now, large volume irrigation, and get me cultures of this tissue. I want to know exactly what we're fighting." Chen moved immediately, signaling to the circulating nurse. "But Dr. Ramirez, this changes everything. This isn't what you were cleared to perform solo." Victoria's hands never stopped. Her fingers worked through infected tissue with practiced precision, identifying viable from necrotic, planning her approach even as she executed it. "I'm aware, But this patient will be septic in hours if we don't address this immediately. We can debate protocol after he's stabilized. For a moment, the OR hung in uncertain balance. Victoria could feel the team's doubt, their fear of deviating from plan, of trusting this temporary surgeon none of them really knew. Then Chen's voice cut through, calm and certain. She's right. I've seen this before in Iraq. If we close now and wait for attending approval, he's dead. Dr. Ramirez, we're with you. Victoria felt something shift. Trust. Tentative and fragile, but present. All right. Extended debridement. We remove all necrotic tissue and block. Aggressive irrigation with minimum 3 liters saline. I want this cavity clean. Her hands moved into a different rhythm now. The economical movements remained, but the pace accelerated. This was combat surgery, field medicine where every second mattered, and indecision killed. Scalpel. Number 15. Blade. Small Richardson retractor. More suction. The commands came rapid fire. Chen anticipated each need, her own field experience allowing her to stay ahead of Victoria's requests. That's a specialized debridement technique, Chen observed, watching Victoria's hands work through infected planes. I've only seen that pattern once before. Forward surgical team protocols. Afghanistan theater. Victoria didn't look up. Focus on retraction. I need better exposure here. But Chen pressed, her voice low. Those knots you're tying. Military-style interrupted sutures. And your stance, the way you're distributing weight. That's operator posture, trained for rapid movement in unstable environments. Are you going to help me save this patient, or interrogate me? Victoria's tone carried an edge now, stress bleeding through her controlled exterior. Both, apparently. Chen adjusted the retractor. But for the record, whoever trained you was exceptional. I've worked with a lot of field surgeons. None of them had hands that moved like yours. Victoria isolated another section of necrotic tissue. Extending here. See this fascial tracking? Classic pattern for deployment-related necrotizing infection. Probably picked it up from contaminated soil or water, microscopic entry point that no one noticed until inflammation became symptomatic. The surgical tech leaned in, his earlier skepticism replaced by fascinated attention. I've never seen anything like this. Hope you never see it again outside training, Victoria said. This kind of infection has a mortality rate above 30% if not caught early. We're right on the edge of that window. She continued debriding, each cut precise despite the speed. Remove here. Irrigate. Check depth. Her fingers explored tissue planes with sensitivity that only came from extensive experience, feeling for the boundary between living and dying tissue. Dr. Kumar called out updated vitals. BP holding. Temp starting to climb slightly. 101.3. Expected response. Victoria didn't pause. His immune system is mobilizing. Keep fluids running. We're going to need broad-spectrum antibiotics as soon as cultures are collected. Already ordered, Chen confirmed. Called ahead to pharmacy. Good. 20 minutes into the extensive debridement, the observation window above the OR filled with faces. Word had spread. Residents, other surgeons, even some administrative staff gathered to watch. Victoria felt their presence but didn't acknowledge it. Let them watch. Let them see what real surgical crisis management looked like. The OR doors burst open. Dr. Thornton stood framed in the entrance, still in street clothes, his face flushed with anger. What the hell is going on in my OR? His voice thundered across the surgical field. I was told Dr. Ramirez expanded a simple cholecystectomy into major debridement without authorization. Victoria's hands didn't stop. Sir, with respect, I'm in the middle of a critical procedure. We can discuss protocol after the patient is stabilized. You were assigned a routine case. This, Thornton gestured at the surgical field, is not routine. No, sir. It's necrotizing fasciitis that would have killed this patient if we'd proceeded with standard cholecystectomy and closed. Thornton moved closer to the table, his fury momentarily overtaken by clinical curiosity. He looked at the exposed tissue, at the clear demarcation between healthy and necrotic fascia, at the extensive debridement Victoria had performed. His expression shifted. The anger didn't disappear entirely, but something else joined it. Professional recognition. How did you know? His voice was quieter now. The imaging didn't show this extent of involvement. Victoria tied off another bleeder. The imaging showed subtle density changes in fascial planes. Combined with the patient's deployment history, environmental exposure records, and the specific pattern of his inflammatory markers, the presentation was consistent with deployment-related necrotizing infection. I've seen this before. Where? Thornton demanded. Where exactly have you seen this specific presentation? Victoria's hands paused for just a fraction of a second. Then she continued working, her voice carefully neutral. In case studies. International journals. I study extensively. Chen and Thornton exchanged looks. Neither believed her, but the evidence was undeniable. Victoria's surgical technique was flawless, her debridement complete. Her handling of a crisis that would have made many experienced surgeons panic was calm, controlled, expert. Continue, Thornton said finally. I'll scrub in. You clearly have this under control, but protocol requires attending oversight for procedures of this complexity. He disappeared to scrub, leaving behind a stunned OR staff and a surgical field that Victoria had transformed from routine to extraordinary in the span of 37 minutes. Chen leaned close. You're not going to be able to hide much longer. Not after this. Victoria focused on irrigation, flooding the surgical field with saline. I'm not hiding. I'm just doing my job. Is that what you call it? Chen's voice held something between respect and suspicion. Because I call it combat-level trauma surgery performed by someone who was supposedly trained at a mid-tier civilian program. Thornton returned, gowned and gloved, and took position across from Victoria. Show me what you found. Victoria walked him through the debridement, pointing out the extent of tissue involvement, the fascial plane tracking, the aggressive but precise nature of her intervention. Thornton listened, asked questions, and with each answer, his expression grew more thoughtful. 32 minutes from initial incision to final closure. Victoria stepped back as Thornton placed the last skin staple. Patient stable. Tissue cultures sent. Broad-spectrum antibiotics initiated. Prognosis excellent if he stays ahead of systemic inflammation. The observation deck erupted in spontaneous applause. Victoria looked up, surprised, to see the crowd of medical staff clapping. Dr. Myers stood with his mouth open. Dr. Park had tears in her eyes. Remarkable work, Thornton said quietly. I've been practicing surgery for 28 years, Dr. Ramirez, and I've never seen diagnostic instincts that sharp combined with technical execution that precise. He pulled off his gloves. We need to talk. My office. 1 hour. Victoria nodded. Yes, sir. As the team broke down the surgical field and prepared Davis for recovery, Chen touched Victoria's shoulder. Whatever you're running from, whatever you're hiding, you just saved that man's life. That counts for something. Victoria didn't answer. She simply walked to the scrub sink and began the ritual of washing, watching the water spiral down the drain, carrying away blood and antiseptic and the last remnants of her carefully maintained anonymity. In 60 minutes, she would have to answer questions she'd been avoiding for 3 months. But right now, Sergeant Davis was alive when everyone else had expected routine. That was enough. Victoria had 38 minutes before her meeting with Thornton. She spent them in the physician's lounge, reviewing Sergeant Davis's post-op vitals and documenting the surgical findings with meticulous detail. Her hands remained steady as she typed, but her mind raced through possibilities. How much would she have to reveal? How much could she protect? The door opened. Dr. Park entered, followed by Myers and Williams. All three stopped when they saw Victoria. Dr. Ramirez. Park's voice carried genuine respect now. All traces of earlier skepticism gone. That was incredible. I've never seen anyone diagnose necrotizing fasciitis that early. The imaging barely showed involvement. Victoria didn't look up from her tablet. The signs were there if you knew what to look for. But most people wouldn't know, Myers said, approaching slowly. Most civilian surgeons wouldn't recognize deployment-related infection patterns. Where did you learn to identify that? Case studies. Victoria's fingers continued typing. International medical literature. I prepare extensively. The 3 residents exchanged glances. Victoria could feel their doubt, their questions. But before anyone could press further, the overhead intercom crackled to life. Trauma alert. Code red. Multiple GSW casualties incoming from classified military operation. All available surgical staff report to ER immediately. ETA 4 minutes. The announcement transformed the lounge instantly. Residents grabbed their white coats and ran. Victoria closed her tablet and followed, her pulse quickening. Multiple gunshot wounds from a classified operation meant special forces, likely SEAL teams operating out of Coronado. The kind of trauma she'd spent 6 years treating in places the Navy officially didn't acknowledge. The emergency department was already organized chaos when she arrived. Nurses prepped trauma bays. Anesthesiologists checked equipment. Thornton stood at the center, delegating assignments with military precision. Listen up. His voice cut through the noise. We have 5 critical patients incoming. Penetrating trauma, likely from ambush scenario. Myers, you take patient Alpha, tension pneumothorax. Park, patient Bravo has abdominal evisceration. I'll handle Delta, combined chest and abdominal trauma. Victoria waited, knowing what was coming. Thornton's eyes found hers. Ramirez, you get patient Echo. Sucking chest wound, but he's the most stable of the group. Just keep him alive until we finish with the critical cases. The words stung more than they should have. Even after proving herself an hour ago, she was still the temporary replacement getting the least important assignment. But Victoria simply nodded. Understood, sir. The distant thunder of helicopter rotors grew louder. Through the ER windows, Victoria could see the medevac bird descending toward the hospital's landing pad, its running lights cutting through the late morning haze. Nurse Chen appeared beside Victoria. You good? Victoria met her gaze. Been through worse. I believe that. Chen's expression was knowing. Just remember, some of these operators might recognize you. Be ready for that. Before Victoria could respond, the ER doors burst open. Military medics rushed in with stretchers, each carrying a wounded SEAL. The air filled with urgent voices, medical shorthand, the metallic smell of blood. Patient Echo here. A medic guided the stretcher toward Victoria's trauma bay. Lieutenant Commander Marcus Steele, SEAL Team 3, penetrating wound to left thorax. Vitals declining. BP 90/60. Heart rate 112. Oxygen saturation 82%. Victoria moved immediately, her hands assessing even as the medics transferred Steele to the trauma bay gurney. The patient was unconscious, his tactical gear already cut away by field medics, his chest wrapped in emergency bandaging that was soaked through with blood. Get me a chest tube kit and prepare for intubation. Victoria's voice carried authority now. No longer the quiet, temporary surgeon everyone underestimated. Chen, I need you. Already here. Victoria cut away the field dressings, exposing the wound. Entry point lateral to left nipple, approximately 4 centimeters in diameter. She placed her gloved hand over the opening, feeling the distinctive sucking sensation as air was drawn into the thoracic cavity with each attempted breath, tension pneumothorax developing. We need to decompress now. She looked at the respiratory therapist. Prepare for emergency needle thoracostomy if he crashes before we can place the tube. But as Victoria worked, something made her pause. She looked at Steele's face, really looked at it for the first time. Dark skin, strong features, a scar above his right eyebrow. Familiar, too familiar. Memory hit like a physical blow. Kandahar, 4 years ago. A young SEAL lieutenant brought in with shrapnel wounds from an IED. She'd operated on him for 6 hours, saved his life when everyone else had given up. His name had been Marcus Steele, Dr. Ramirez. Chen's voice pulled her back. You okay? Victoria forced herself to focus. Fine. Let's intubate him before the lung collapses completely. Her hands moved through the familiar motions, but her mind was elsewhere. If this was the same Marcus Steele, if he recognized her, if he said something about Kandahar in front of Thornton and the staff, everything would unravel. Patient intubated. Chen confirmed placement. Tube is good. Oxygen saturation rising. 87%. 90. Victoria prepared for chest tube placement. She palpated Steele's ribs, finding the intercostal space, marking the insertion point. The technique was second nature. performed hundreds of times in field hospitals where precision meant the difference between survival and death. Scalpel. She made the incision, creating an opening between the ribs. Blood welled immediately, but not excessively. She inserted the chest tube with practiced ease, feeling it slip past resistance into the pleural space. Suction on. The tube began draining blood and air from around Steele's collapsed lung. His oxygen saturation climbed. 92, 95, 97. Vitals stabilizing, the monitoring nurse called out. BP 105/70. Heart rate dropping to 96. Good. Victoria secured the tube and checked the wound again. But we're not done. This entry wound suggests the projectile may have nicked the pericardium. I need imaging to confirm before we close. A military medic who'd stayed with Steele's case leaned closer, studying Victoria's technique. His eyes narrowed as he watched her hand movements, the way she positioned herself at the trauma bay. Ma'am, his voice was quiet but insistent. Have we worked together before? Your stance, the way you handle equipment, that's operator posture. Combat surgical protocol. I trained extensively, Victoria said without looking at him. Advanced trauma courses. The medic didn't look convinced. No disrespect, ma'am, but I've worked with a lot of surgeons. Civilian training doesn't create reflexes like that. You move like someone who's operated under fire. Focus on your patient, soldier. But the medic persisted. When you reached for that scalpel, you checked 6 o'clock position first. That's threat assessment instinct. You don't learn that in a hospital, you learn it downrange. Before Victoria could respond, Steele stirred. The sedation was light enough to allow spontaneous breathing, but it meant he might have moments of consciousness. His eyes fluttered open, unfocused and confused. Doc. His voice was barely a whisper, slurred from medication. Doc Ramirez? Kandahar. Patterson. You saved. Victoria's breath caught. Chen heard it. The medic heard it. And across the ER, Dr. Thornton looked up from his own patient, his attention suddenly locked on Victoria's trauma bay. Rest, Lieutenant. Victoria kept her voice calm despite her racing pulse. You're safe. You're at Regional Medical Center. But Steele's hand reached out, grasping her scrub top with surprising strength. They said you were... discharge. Wrong. You were right to stay. His eyes closed again, consciousness slipping away, but the damage was done. The ER had gone quiet. All eyes were on Victoria, Dr. Ramirez. Thornton's voice carried across the space. Finish stabilizing your patient. Then my office, immediately. Victoria nodded, not trusting her voice. She continued working on Steele, checking lines, confirming tube placement, ordering imaging. Chen stood beside her, silent but supportive. The portable ultrasound revealed what Victoria had suspected. Small pericardial effusion, likely from the projectile grazing the heart sac. Not immediately life-threatening, but requiring monitoring. He needs cardiothoracic consultation, Victoria told Chen, and continuous observation for at least 48 hours. If that effusion expands, he'll need surgical drainage. I'll arrange it. Chen's hand touched Victoria's shoulder briefly. Whatever happens with Thornton, you saved 5 lives today. Don't forget that. Victoria stripped off her bloody gloves and walked toward the scrub sinks. In the reflection of the steel surface, she saw herself, dark eyes staring back. Tired, exposed. 3 months of hiding. Destroyed in a single morning. Behind her, she heard whispered conversations. Residents speculating. Nurses sharing observations. The military medic making calls, probably to Steele's command, reporting that their wounded officer had recognized his surgeon from Kandahar. The walls she'd built so carefully around her past were crumbling, and the only question remaining was how much of the truth she'd have to reveal, and what it would cost her when she did. Victoria dried her hands and started walking toward Thornton's office, every step feeling like she was marching toward a court-martial she'd already experienced once before. Victoria stood outside Thornton's office, her hand hovering over the door handle. Through the frosted glass, she could see his silhouette pacing, phone pressed to his ear. She was about to knock when the door opened from inside. Come in, Dr. Ramirez. Thornton's voice was controlled, but tension radiated from every word. "And close the door behind you." The office was exactly what she'd expected. Diplomas lining the walls, medical journals stacked on shelves, a massive desk covered in case files. But what caught her attention was the second person in the room. Colonel James Davis, the hospital's military liaison, stood beside the window in full-dress uniform. "Sir." Victoria addressed the colonel first, military protocol automatic, despite years of trying to suppress those instincts. Thornton gestured to a chair. "Sit. We have questions, and this time I expect real answers." Victoria remained standing. "With respect, sir, I have 3 patients in critical condition that require monitoring. Whatever questions you have can wait until they're stabilized. They're being monitored by competent staff." Thornton's eyes narrowed. "What can't wait is understanding exactly who we have operating in my surgical department." Colonel Davis stepped forward. "Dr. Ramirez, we pulled your file after Lieutenant Commander Steele's recognition of you. The file shows you graduated from a mid-tier civilian program 2 years ago. No military service listed, no trauma fellowship. Nothing that would explain the level of surgical expertise we witnessed today." Victoria's pulse quickened, but her expression remained neutral. "I study extensively. Advanced techniques, international protocols. Don't insult us." Thornton's patience was fraying. "That necrotizing fasciitis diagnosis? The specific debridement pattern you used? Those aren't learned from journals. And the way you handled Steele's penetrating chest trauma, Nurse Chen said you performed techniques she only saw in forward surgical teams in Iraq. Captain Chen has extensive field experience," Victoria said carefully. "Perhaps she recognizes patterns from her own training." "Nice try." Davis opened a tablet. "But Chen specifically noted that your stance, your equipment handling, even the way you checked your surroundings before focusing on the patient, all indicate combat medical training, and Steele called you Doc Ramirez from Kandahar. The name registered. Nothing more. Lieutenant Commander Steele was delirious from pain medication and trauma." "Was he?" Thornton leaned against his desk. "Because he mentioned Patterson. And when we searched military medical records, we found reference to a Navy surgeon named Ramirez, who operated on a Lieutenant Patterson in Kandahar 4 years ago during a Taliban mortar attack. That surgeon was Captain Victoria Ramirez, Navy SEAL combat surgeon." The words hung in the air between them. Victoria felt the walls she'd built crumbling, but she refused to show it. That surgeon was dishonorably discharged. She doesn't exist anymore. So you admit it. Davis's voice softened slightly. "You are Captain Victoria Ramirez." "I was." Past tense. Victoria met his gaze directly. "Now I'm Dr. Victoria Ramirez, temporary surgical staff, and I have patients who need me." Before anyone could respond, Thornton's phone buzzed urgently. He answered, his face paling as he listened. "When? How bad?" He looked at Victoria. "Patient in OR2 is crashing. Hepatic artery repair complications. Massive bleeding. Dr. Park is requesting immediate assistance. That's not my case." Victoria turned toward the door. Thornton grabbed his white coat. "Actually, it is now. Park can't control it. You're the only surgeon available with the skill level this requires." They ran toward the surgical wing, conversation abandoned in face of emergency. Victoria's mind shifted automatically into combat mode, every other concern falling away. A patient was dying. Nothing else mattered. OR2's doors burst open as they entered. Dr. E. Park stood at the table, her gloves soaked in blood, her face showing barely controlled panic. The patient on the table was one of the SEALs from the earlier trauma, a captain with multiple penetrating wounds. "I can't find the bleeder." Park's voice trembled. "Every time I think I have it controlled, a new vessel tears." "He's lost 3 units already." Victoria moved to the table, not bothering to scrub in. She'd reglove, but every second counted. "Let me see." Park stepped back, relief and shame mixing on her face. Victoria's eyes scanned the surgical field, reading the anatomy, the blood patterns, the failed attempts at control. This isn't just hepatic artery. The projectile tracked through the porta hepatis and involved the portal vein. You're chasing individual bleeders when you need damage control protocol. "What protocol?" Park asked. Combat liver packing. Victoria's hands were already moving, directing the surgical tech. I need lap pads. Multiple. And prepare for temporary closure. We're not fixing this definitively. We're buying time. That's not standard civilian procedure, Thornton said from the observation area. It's military field surgery. Victoria didn't look up. When you can't achieve definitive repair under current conditions, you damage control, stabilize, and plan second-look surgery in controlled circumstances. His voice came over the intercom. Can you do it? I've done it 17 times. All 17 patients survived. Then do it now. Victoria's hands worked with practiced efficiency. Pringle maneuver first. Clamp the porta hepatis to temporarily stop inflow. The bleeding slowed but didn't stop completely. Portal vein involvement confirmed. She packed the liver with lap pads, creating pressure to control venous bleeding. Pack here and here. Firm pressure. The monitors showed blood pressure starting to climb. The anesthesiologist called out improved numbers. It's working, Park breathed. For now, Victoria continued packing systematically. But he needs ICU monitoring and second-look surgery in 6 to 8 hours, once he's fully resuscitated and coagulation is corrected. That timeline seems risky, Thornton observed. Keeping him on the table, trying for definitive repair right now is riskier. Victoria began temporary closure, placing retention sutures to hold the abdomen together without compression. He's hypothermic, acidotic, and coagulopathic. The deadly triad of trauma. If we don't stop now, he dies here. She finished closure and stepped back. Vitals are stabilizing. He's packed, closed, ready for ICU. Call me when it's time for second look. Before anyone could respond, Chen burst into the OR. Dr. Ramirez, you're needed back in the ER. Lieutenant Commander Steele is coding. Victoria was already moving, stripping off bloody gloves as she ran. Behind her, she heard Thornton's voice. I'm coming with you. The ER was chaos when they arrived. Steele lay on a gurney, monitors screaming, crash cart beside him. Residents performed compressions while nurses prepared medications. What happened? Victoria pushed through to the bedside. Pericardial effusion expanded. Chen's voice was tight. The chest tube isn't draining it. He went into cardiac arrest 2 minutes ago. Victoria looked at the monitor. Pulseless electrical activity. The heart was trying to beat, but the fluid around it prevented effective contraction. She had one option, one chance. I need to do emergency pericardiocentesis. Get me an 18-gauge needle, 60cc syringe, and ultrasound guidance. That requires specialized training, one of the residents protested. I have the training. Victoria was already positioning equipment. Continue compressions. Stop when I say. Thornton appeared beside her. Do you know what you're doing? Victoria didn't answer. She placed the ultrasound probe on Steele's chest, finding the heart, the dark fluid surrounding it. There, she said, marking the entry point. Subxiphoid approach. Stop compressions. The resident hesitated, then stepped back. Victoria inserted the needle, advancing it carefully under ultrasound guidance. Too shallow and she'd miss the effusion. Too deep and she'd puncture the heart itself. The needle entered the pericardial space. Dark blood flowed back into the syringe. I'm in. Aspirating now. She withdrew fluid steadily, watching the ultrasound. As the pressure around Steele's heart decreased, the chambers expanded. The heart began contracting more effectively. The monitor changed. The rhythm organized. A pulse appeared. We have spontaneous circulation, the monitoring nurse called out. BP 70/40, heart rate 96. Victoria withdrew another 20 cc's. BP climbing, 80/50, 90/60. He's back. Chen's voice held awe. You brought him back. Victoria removed the needle and applied pressure to the puncture site. He needs cardiothoracic surgery. Formal pericardial window to prevent reaccumulation. I'll call them now. Thornton was staring at Victoria like he'd never seen her before. Where did you learn to perform pericardiocentesis under those conditions? Kandahar, Ramadi, Mosul. Victoria's voice was flat, exhausted. Wherever Navy SEALs were dying, and I was the only surgeon left standing. The admission hung in the air. No more deflection. No more careful half-truths. Just the raw reality of who she'd been and what she'd done. Thornton's expression shifted from anger to something more complex. Understanding, perhaps? Or recognition that he'd been wrong about her from the beginning. My office. 1 hour. He turned to leave, then paused. And Dr. Ramirez? That was exceptional work. All of it. Victoria watched him go, then looked down at Steele's face. The young SEAL was stable now, breathing easier, color returning to his skin. She'd saved him twice. 4 years apart, in 2 different countries, under circumstances that couldn't have been more different. Chen touched her shoulder. Whatever happens next, you saved 3 lives today that everyone else had written off. That counts for something. Victoria stripped off her gloves and walked toward the scrub sink. Her reflection stared back from the steel surface, and for the first time in 3 months, she didn't see the ghost she'd been trying to become. She saw Captain Victoria Ramirez, Navy SEAL combat surgeon, and she couldn't hide anymore. Victoria had 47 minutes before her scheduled meeting with Thornton. She spent them reviewing Steele's cardiothoracic consultation and checking on the packed liver patient in ICU. Both were stable. Both alive because of techniques she'd spent 6 years perfecting in places the Navy didn't officially acknowledge. She was walking back toward Thornton's office when the hospital's main entrance doors burst open. 6 men in tactical gear stormed through, their boots thundering on the polished floors. Security moved to intercept, but the lead operator pulled identification that made the guards immediately step back. SEAL Team 3. The commander's voice carried authority that stopped all conversation in the lobby. We're here for Lieutenant Commander Steele. Which way? Victoria recognized the leader immediately. Commander James Hawkins, 41 years old, with salt and pepper hair cut military short and a scar across his neck from a Taliban knife that had come too close. She'd operated on him too, 5 years ago in Syria, during an operation that officially never happened. For a moment, Victoria considered turning away, disappearing before Hawkins saw her. But escape was no longer an option. Not after this morning. Not after Steele's recognition had blown her cover completely. Hawkins's eyes swept the lobby and locked on her. He froze mid-stride, his expression cycling through disbelief, recognition, and something that looked like relief. Ramirez. His voice cracked slightly. Captain Ramirez? The lobby went silent. Every eye turned to Victoria. She felt the weight of their attention. The questions forming, the assumptions crumbling. Commander. She kept her voice steady. Lieutenant Commander Steele is in ICU, 4th floor, Bay 7. He's stable. Hawkins crossed the distance between them in 3 strides. His team followed, forming a protective semicircle around their commander. The tactical display was automatic, unconscious. The kind of formation operators used when protecting high-value personnel. We were told Steele was critical. Cardiac arrest on the table. Hawkins studied her face. They said a surgeon saved him using combat field techniques. I didn't believe it until I saw your name on the surgical report. I did my job. Nothing more. Your job? Hawkins's voice rose slightly. Doc, you disappeared 3 years ago. We looked everywhere. After what happened in Kandahar, after that bullshit discharge, you vanished. Where the hell have you been? Working. Victoria was aware that the lobby had filled with hospital staff, residents, nurses, all watching this confrontation unfold. Commander, your team can see Steele now. He's awake and asking for you. Hawkins didn't move. After Kandahar, after they court-martialed you for saving those civilian lives, we tried to fight it. The entire team testified that you made the right call, that those kids would have died without immediate intervention. But command needed a scapegoat for the 2 Marines who died covering the hospital during the attack. I know what happened. Victoria's voice was flat. I was there. You took the discharge to protect us. One of the other SEALs stepped forward, his face scarred from old burns. You accepted dishonorable discharge so command wouldn't punish the entire surgical team for supporting your decision. We know that, Doc. We've always known. The words hung in the air. Victoria felt something in her chest tighten. Old wounds reopening. This isn't the place for this conversation. Actually, it is. Thornton's voice came from behind her. Victoria turned to find him standing with Colonel Davis, both having witnessed the entire exchange. Because it explains everything Dr. Ramirez has been hiding for 3 months. "Sir?" Victoria began, but Thornton raised a hand. "Commander Hawkins, I'm Dr. Richard Thornton, Chief of Surgery. Your officer is receiving excellent care, but I need to understand exactly who Captain Ramirez is and why she's been operating in my hospital under false pretenses." "False pretenses?" Hawkins's voice carried an edge now. Doc Ramirez is one of the finest combat surgeons the Navy SEALs ever had. 6 years of forward operations, over 800 surgeries, 97% survival rate in conditions that would break most civilian surgeons. Then why wasn't that in her file? Davis stepped forward. Why did her application show mid-tier civilian training with no military background? Because she was dishonorably discharged. Victoria's voice cut through the growing tension. Because no hospital would hire someone with that on their record, no matter how skilled they were. So I omitted it. I lied. And I'd do it again, if it meant I could keep practicing medicine. The admission sent ripples through the watching crowd. Victoria saw shock on some faces, understanding on others. Chen stood near the nursing station, her expression unreadable, but not surprised. Hawkins pulled out his phone. "I have something Command finally declassified last month. Something that changes everything." He brought up a document, turned the screen toward Thornton and Davis. "This is the after-action report from the Kandahar incident. Intelligence failure caused that attack. It was scheduled 30 minutes before Doc Ramirez even began operating on those civilians. The Marines who died were defending against an attack that was coming regardless of her decision." Victoria's breath caught. "What? You were the scapegoat." Hawkins's voice softened. "Command knew the attack wasn't your fault, but they needed someone to blame for the intelligence failure. You were convenient. A surgeon who disobeyed direct orders to evacuate, even if those orders would have meant letting 5 people die. She took the discharge to protect her team," Davis said slowly, reading the document, "and to protect the command structure from accountability." "Exactly." Hawkins put his phone away. "I've been searching for Doc Ramirez for 6 months, since this was declassified. To tell her the truth, to offer reinstatement, to fix the injustice." Victoria's legs felt unsteady. All this time, 3 years of believing she'd caused those deaths, of carrying the weight of that guilt. Before anyone could respond, the hospital alarm system screamed to life. "Code Blue, ICU Bay 12. Code Blue, ICU Bay 12. That's the packed liver patient." Victoria was already moving, her conversation with Hawkins immediately set aside. "Thornton, we need to go now." They ran toward the ICU, Hawkins and 2 of his SEALs following. The other operators headed for Steele's room, their priorities clear. ICU Bay 12 was controlled chaos when they arrived. The patient, the SEAL captain from earlier, was crashing. Monitors showed dropping blood pressure, increasing heart rate. The packed liver was failing. PAC expansion. Victoria assessed the situation instantly. The bleeding's restarting. "We need to get him back to OR immediately. He's too unstable to transport." The ICU attending was already starting resuscitation protocols. "We'll lose him in the elevator." Victoria looked at Thornton. "Then we operate here. Emergency re-exploration. Bring a surgical kit to this bay. Now. You can't do major surgery in ICU." The attending protested. "Watch me." Victoria was already gloving. "Thornton, I need you scrubbed and ready. This is going to be fast and dirty." Hawkins stepped forward. "What do you need, Doc?" "Keep everyone else out of this bay. Give us room to work. And if any of your team are field-rated medics, get them in here. 2 of my guys are 18 Deltas. They're with Steele, but I can call them down. Do it." Victoria didn't wait for full surgical setup. She opened the patient's temporary abdominal closure right there in the ICU bay, exposing the packing. Blood welled immediately. Suction. She worked by feel as much as sight. The porta hepatis clamp has loosened. That's why he's rebleeding. Her hands moved into the abdominal cavity, navigating by touch through blood and tissue. This was the kind of surgery that happened in field hospitals during firefights, when you operated by instinct and experience because conditions made precision impossible. Found it. Major hepatic vein tear. The pack shifted and exposed it. Thornton positioned himself opposite her. Can you repair it here? Have to. Victoria's fingers isolated the vessel. She worked with speed that made the ICU staff step back in awe. Suture, 4-neuroproline. Fast. Chen appeared with the suture, having anticipated Victoria's need. Here. Victoria repaired the tear in 90 seconds. Each stitch placed with precision despite the challenging conditions. Then she repacked the liver, this time with better pressure distribution. The monitors stabilized. Blood pressure climbed. Heart rate normalized. Jesus. The ICU attending stared. I've never seen anyone operate that fast under those conditions. Combat surgery. Hawkins's voice held pride. That's what Doc Ramirez does. That's what she's always done. Victoria closed the abdomen with retention sutures, creating temporary but secure closure. He's stable now. But we need formal OR exploration within 6 hours. This is just buying time. She stepped back, exhausted. Her scrubs were soaked with blood. Her hands trembled slightly now that the adrenaline was fading. But the patient was alive. The ICU bay door opened. Colonel Davis entered with a woman in Navy dress uniform. Captain Ramirez, the woman said. I'm Commander Sarah Blake, Navy Medical Corps. I've been sent to discuss your situation. My situation? Victoria pulled off her bloody gloves. Your potential reinstatement. Blake glanced at the patient. And apparently, to witness exactly why the Navy needs you back. Victoria looked at Thornton, at Hawkins, at the patient she'd just saved for the 3rd time in 12 hours. When everyone tells you to give up, when the rules say it can't be done, how far would you go to save a life? What would you sacrifice for the truth? She'd sacrificed everything once. Career, reputation, identity. But standing here, covered in blood, surrounded by people who finally understood what she could do, Victoria realized she'd been given a second chance. The question was whether she was brave enough to take it. Thornton's conference room felt different now, less like an interrogation chamber and more like a war room where critical decisions were made. Victoria sat at the table, still in blood-stained scrubs, flanked by Commander Hawkins and Commander Blake from Navy Medical Corps. Thornton and Colonel Davis sat across from them. Dr. Ramirez, Blake began, opening a tablet. I've reviewed your service record. 6 years as Navy SEAL combat surgeon, 817 documented surgeries, 97.3% survival rate in theater, 3 Navy Commendation Medals, 2 for combat valor. You're exactly the kind of surgeon the Navy needs. Needed, Victoria corrected quietly. Past tense. I was dishonorably discharged. Wrongfully discharged. Blake turned the tablet toward her. This is the declassified after-action report from Kandahar. The intelligence failure that caused the attack on your field hospital was documented 3 hours before you began operating on those civilians. Command knew the attack was coming regardless of your decision to stay. Victoria stared at the document, reading words that rewrote 3 years of guilt. They knew? Her voice barely rose above a whisper. They knew. Hawkins leaned forward. You weren't responsible for those Marine deaths, Doc. You never were. Command needed a scapegoat for their failure, and you were convenient. A surgeon who disobeyed evacuation orders. Even if those orders would have meant letting 5 people die. The room fell silent. Victoria felt something breaking inside her. Walls she'd built around old trauma crumbling under the weight of truth. Those kids I saved. The 2 who were critical. Did they? They lived. Blake pulled up photos on her tablet. This is Amira Hassan, now 21 years old. She's in her 2nd year of medical school in Kabul. Wants to be a surgeon like you. And this is her brother Rashid, studying engineering. Both alive because you refused to abandon them. Victoria's vision blurred. She pressed her palms against the table, trying to anchor herself against the flood of emotion threatening to overwhelm her. Dr. Ramirez. Thornton's voice was gentler now. No trace of the earlier antagonism. I owe you an apology. A significant one. I judged you without understanding who you were or what you'd sacrificed. You had reason to be suspicious, Victoria managed. I did lie on my application. You omitted information because you believed you had no other choice. Thornton stood, pacing to the window. This morning, I watched you diagnose necrotizing fasciitis that everyone else missed. I saw you perform emergency pericardiocentesis under conditions that would terrify most cardiothoracic surgeons. And I just witnessed you conduct major vascular repair in an ICU bay with minimal equipment. Dr. Ramirez, you're not just competent, you're exceptional. That's why we're here, Davis said. The Navy wants to offer you full reinstatement and promotion to major. Your discharge will be expunged, your record corrected, and you'll receive back pay for 3 years. Victoria looked up sharply. Reinstatement? With conditions you get to set. Blake smiled slightly. The Navy learned something from losing you, Captain. We don't want to make the same mistake twice. What kind of conditions? Victoria's mind raced through possibilities, through what she needed versus what she'd been afraid to ask for. Whatever you need to come back. Hawkins's voice was firm. Training programs? You design them. Duty station? Your choice. Hell, Doc, if you want to establish a civilian military surgical training center, Command will fund it. You name it. Victoria stood, walking to the window beside Thornton. Outside, she could see the hospital grounds. Ambulances coming and going. Medical staff moving between buildings. This place had been her refuge for 3 months, her hiding spot from a past she'd thought would destroy her. But the past wasn't what she'd believed. And maybe the future could be different too. I have 3 conditions. Victoria turned back to face them. Non-negotiable. Name them. Blake pulled up a new document on her tablet. First, I want to establish a combat-to-civilian transition program for military medical personnel. Too many veterans with exceptional skills can't find positions because they don't fit traditional hiring criteria. We fix that. Agreed. Blake was already typing. What else? Second, I train both military and civilian surgeons in forward surgical techniques. The skills that save lives in combat zones work just as well in mass casualty situations at home. We need to stop treating battlefield medicine and civilian trauma as separate disciplines. That's actually brilliant. Davis nodded. We've been discussing that exact issue at command level. You'd be the perfect person to lead that integration. And third, Blake looked up from her tablet. Victoria's voice hardened. No more scapegoats. When command makes mistakes, they own them. They don't sacrifice good people to cover intelligence failures or operational errors. If I come back, that culture changes. Starting now. The room went quiet. Blake exchanged glances with Hawkins, then with Davis. That's asking for significant institutional change, Captain Ramirez. I know. Victoria met Blake's gaze directly. But if the Navy wants me back, that's the price. I won't watch another surgeon or medic take the fall for decisions they didn't make. Hawkins smiled. That's my doc. Never did know when to play it safe. Blake closed her tablet. I can't approve that third condition on my own authority, but I'll take it to the Admiral personally, with my strong recommendation that he agree. How long until I have an answer? 72 hours. Blake stood, extending her hand. In the meantime, Captain Ramirez, consider yourself on temporary active duty status. Your Navy credentials are restored pending final approval. Victoria shook her hand, feeling the weight of the title she'd thought she'd lost forever. Captain Ramirez. It felt foreign and familiar at once. Thornton cleared his throat. Commander Blake, if I may. Regardless of Captain Ramirez's final decision, I'd like to offer her a permanent position here as head of trauma surgery. Full attending privileges, complete autonomy in developing training programs, and the resources to implement her vision for combat civilian integration. You're offering me a job? Victoria's surprise was genuine. After I lied on my application, you omitted information under duress. Thornton's expression was earnest. But your skills, your instincts, your surgical excellence, those were never lies. This hospital, this community, needs what you can teach us. Whether you return to the Navy or not, you have a home here. Before Victoria could respond, someone knocked urgently on the conference room door. Chen entered without waiting for permission. Dr. Ramirez, Lieutenant Commander Steele is awake and asking for you. She paused, noticing the assembled brass. My apologies for interrupting, but he's insistent. I should go. Victoria stood, grateful for the escape from the emotional intensity of the room. "We'll walk with you." Hawkins and 2 of his SEALs followed her out. The walk to ICU gave Victoria time to process. Reinstatement, promotion. 3 conditions that might actually change how the military handled its medical personnel. And a job offer that meant she'd never have to hide again. Steele's ICU bay was filled with his team. They parted immediately when Victoria entered, forming that same protective semicircle around their wounded officer, Doc Ramirez. Steele's voice was weak but clear. "Twice now. Kandahar and here. You keep saving my life. That's the job, Lieutenant Commander." Victoria checked his monitors. "Vitals look good. How's the pain?" "Manageable." His eyes searched her face. "I heard about what happened after Kandahar." "The discharge. Doc, that was wrong." "Everyone knew it was wrong. I know that now." Victoria adjusted his IV line. "Focus on healing. Your team needs you operational. They need you more." Steele reached out, grasping her hand with surprising strength. "Come back, Doc. The teams need surgeons like you. People who don't give up when everyone else says it's hopeless. I'm considering it. Consider faster." He smiled, despite obvious discomfort. "Because we've got a mission in 6 weeks, and I'd feel a lot better knowing you're our surgical backup." 6 weeks? Victoria raised an eyebrow. "You just had emergency pericardiocentesis and you're planning operations?" "SEAL mentality." Hawkins spoke from the doorway. "We never stop planning the next mission." Victoria left Steele to rest and found Chen waiting in the corridor. The nurse's expression was knowing, almost maternal. "You're going back, aren't you?" Chen said. "To the Navy." "I don't know yet." Victoria leaned against the wall, exhaustion finally catching up. 3 hours ago, I was a temporary surgeon trying to disappear. Now I'm being offered my entire career back. You never stopped being Captain Ramirez. Chen's voice was gentle. You just wore a different name for a while. But those hands, that skill, that refusal to give up, that was always you. What would you do? If you were in my position? Chen smiled. I'd ask myself one question. Where can I save the most lives? Where can I train the most surgeons, teach the most skills, make the biggest difference? Then I'd go there. What if the answer is both places? Victoria looked back toward Steele's Bay. What if I don't have to choose? Then you find a way to do both. Chen touched her shoulder. You're Captain Victoria Ramirez, Navy SEAL combat surgeon. You've operated under enemy fire, saved lives everyone else had written off, and rebuilt your career from nothing. Finding a way to serve in 2 places at once? That's probably the easiest thing you'll do this year. Victoria laughed despite herself. When did you become so wise? Iraq taught me. Chen's expression turned serious. 2 tours of watching people like you perform miracles under impossible conditions. You're not meant to be hidden, Victoria. You're meant to be leading. 3 months later, Victoria stood in front of a classroom filled with surgical residents and military medics, her Navy dress uniform crisp and formal. The integration program had been approved, funded, and implemented faster than anyone thought possible. Behind her, a screen displayed images from Kandahar, from Ramadi, from a dozen field hospitals where she'd operated under conditions these students couldn't imagine. Combat surgery isn't about following protocols. Her voice carried authority earned through 6 years of saving lives in war zones. It's about adapting protocols to impossible situations. It's about using whatever tools you have to do whatever must be done. And most importantly, it's about never giving up on a patient just because the textbook says it's hopeless. In the audience, she saw familiar faces. Chen, now part of the training staff. Thornton, observing with professional respect. Hawkins and several of his SEALs, back from their latest mission. And in the front row, Sergeant Davis, the necrotizing fasciitis patient who'd started this entire transformation. Excellence isn't about following the rules, Victoria continued. It's about knowing when to break them to save a life. Your past doesn't define you. Your choices do. The classroom erupted in applause as she finished. But Victoria's mind was already on the next challenge. Pentagon had called that morning. They wanted her to design surgical protocols for the entire special operations community. and Thornton had 2 new trauma cases that needed her expertise. Captain Victoria Ramirez was exactly where she was meant to be, and she was just getting started. 3 months had reshaped everything. Victoria stood in the simulation lab she'd designed, watching 20 surgical residents practice damage control techniques under simulated combat conditions. The space was state-of-the-art, funded by a joint Pentagon and hospital initiative that had been approved in record time. Dr. Ramirez, a young resident, approached, her face flushed from the intensity of the training scenario. "That liver packing technique you demonstrated, I've never seen anything work that fast under pressure. Speed matters when the patient is bleeding out." Victoria gestured toward the simulation mannequin. "But precision matters more. Show me your suture placement again." The resident moved back to the training station, her hands steadier now, more confident. Victoria watched with the same critical eye she'd used in field hospitals across 3 continents, but without the weight of actual lives hanging in the balance. Here, mistakes were learning opportunities. In Kandahar, mistakes meant body bags. Excellent. Victoria nodded approval. "You're thinking like a combat surgeon now, not just following protocols but adapting them to the situation." The resident beamed. "Thank you, ma'am. This program, what you're teaching us, it's changing how I think about surgery entirely." As the resident returned to her station, Chen appeared in the doorway. "Victoria, you have visitors. Military delegation from FEMA. They want to discuss expanding your training program nationally." "Already?" Victoria checked her watch. "I thought that meeting was tomorrow. They moved it up." Chen's expression was knowing. "Word's spreading fast about what you're accomplishing here." 17 military medical personnel successfully transitioned to civilian positions in 3 months. 94% retention rate. That's unprecedented. Victoria followed Chen toward the conference room, her mind already shifting to the presentation she'd prepared. The hallways were familiar now, no longer the hostile territory they'd felt 3 months ago. Residents nodded respectfully as she passed. Nurses greeted her by name. She belonged here in a way she'd never belonged anywhere since leaving the Navy. The conference room held more people than she'd expected. FEMA administrators, Pentagon liaisons, hospital board members. And standing at the head of the table, Thornton, looking distinctly proud, Captain Ramirez. A woman in Navy dress uniform stood to greet her. "Commander Patricia Morrison, Navy Medical Corps. We've been reviewing your program results. Frankly, they exceed every projection we had." Victoria shook her hand. "The credit belongs to the participants. They bring the skills. I just help them translate combat experience into civilian context. You do considerably more than that." Morrison opened a tablet displaying statistics. "Your integrated training approach has reduced surgical complications by 23% across participating facilities. Your damage control protocols are now being adopted by 12 major trauma centers. And the Pentagon wants to make your program mandatory for all special operations medical personnel transitioning to civilian life. That's ambitious." Victoria sat, aware that every eye in the room was on her. "We'd need significantly more resources, additional training facilities, expanded staff." All approved. A man in a FEMA jacket spoke up. "We're prepared to fund a national rollout. 6 regional training centers, each one following your model. You'd oversee the entire program." Before Victoria could respond, her phone buzzed urgently. She glanced at the screen. "Emergency from OR5. She looked at Thornton. "I'm sorry, but I need to go." "We'll come with you." Morrison stood immediately. "If we're expanding this program, I want to see what makes it work firsthand." They arrived at OR5 to find controlled chaos. A patient on the table, monitors alarming, surgical team struggling. Dr. Park looked up with visible relief when Victoria entered. "Hepatic trauma, similar to the case you handled 3 months ago. We can't control the bleeding." Victoria assessed the situation in seconds. "The packed liver technique, except you've got the pressure distribution wrong. Let me show you." She moved to the table, not bothering to scrub. Her hands guided Parks, demonstrating the proper placement. Here and here. Firm, but not crushing. You're trying to stop bleeding, not create ischemia. The monitors stabilized. Blood pressure climbed. Park stared at her hands like they belonged to someone else. "How did you know exactly where to place pressure?" Because I've done this 87 times under fire. Victoria stepped back. You'll do it differently every time based on the specific injury pattern. That's what combat surgery teaches you. Adaptation. Morrison watched from the observation deck, her expression thoughtful. That's what we need to capture. Not just the technical skills, but the mindset. After the patient was stabilized and transferred to ICU, Victoria returned to the conference room. The delegation was no longer seated formally. They stood in animated discussion, clearly energized by what they'd witnessed. Dr. Ramirez. Morrison pulled Victoria aside. What you did in that OR, that's exactly why we need this program nationwide. How many lives could we save if every trauma surgeon had those instincts? It's not about instincts. Victoria leaned against the table. It's about experience, training, and willingness to break rules when rules will kill the patient. That mindset takes time to develop. Then we give them that time. Morrison's voice was firm. 6 regional centers, full funding, your oversight. Will you accept? Victoria looked through the window toward the surgical wing. In the 3 months since her identity had been revealed, she'd trained 47 surgeons, saved countless lives, and rebuilt a career she'd thought was gone forever. But this offer represented something bigger. A chance to transform military-civilian medical integration on a national scale. I accept. On the same 3 conditions I gave before. No scapegoats, full support for transitioning veterans, and complete autonomy in training methodology. Agreed. Morrison extended her hand. Welcome to the biggest challenge of your career, Captain Ramirez. That evening, Victoria sat in her office reviewing patient files when someone knocked. Steele entered, now fully recovered and back on active duty. Doc. He smiled. Came to say goodbye before we deploy. Middle East, classified location, you know the drill. Stay safe out there, Lieutenant Commander. That's the plan. Steele handed her an envelope. This is from the team. All of us. We wanted you to have it. Inside was a photo. Steele's entire SEAL team, standing together, holding a banner that read, Doc Ramirez, our guardian angel. Below it, a handwritten note. Because you never gave up on us. Victoria's eyes stung. You guys didn't have to do this. Yes, we did. Steele's voice was serious now. You saved my life twice. You saved most of our team at some point. And now you're training the next generation to save even more. Doc, you're a hero. Own it. After Steele left, Victoria stared at the photo for a long time. Behind her, the wall displayed certificates, awards, commendations she'd received in the past 3 months. But this photo mattered more than all of them combined. Her phone buzzed. A text from Hawkins. Heard about the national program. Proud of you, Doc. The teams will always have your back. Another text from Chen. Drinks tonight to celebrate? You've earned it. And one from Thornton. Board approved your promotion to Chief of Trauma Surgery. No more temporary status. Welcome home. Victoria's journey had started with hiding, with trying to disappear from a past she'd thought would destroy her. But standing here now, surrounded by evidence of lives saved and careers rebuilt, she understood something fundamental. Excellence wasn't about following rules. It was about knowing when to break them to save a life, and redemption wasn't about erasing the past. It was about using that past to build something better. But Victoria's story is just one among thousands. Across military bases and hospitals worldwide, countless other veterans struggle with transitions, fight battles no one understands, carry skills that civilian systems don't recognize. Their stories of transformation and service are waiting to be discovered. Their expertise is waiting to be valued. By walking away now, you're leaving these stories untold, these heroes unrecognized. You're missing the chance to witness how courage takes many forms, how surgery can be warfare against death itself, how one person's refusal to give up can transform entire systems. A true supporter of our emergency heroes never abandons those still fighting to find their place. If this story moved you, share your thoughts in the comments below. Tell us about the medical professionals in your life who refuse to give up. Tell us about the time someone's expertise saved what others thought was lost. Thank you for taking this journey with us. Your time means everything. If Victoria's story touched your heart, We have an entire collection of incredible tales waiting. Stories of underestimated professionals who prove everyone wrong, of second chances that change everything, of expertise that defies all expectations. And if you want to ensure you never miss our next powerful story, hit that subscribe button. We'd be honored to welcome you into our Emergency Heroes Stories family. Victoria stood at her office window, watching ambulances arrive with new patients, new challenges, new opportunities to prove that giving up was never an option. Her past had tried to break her. Instead, it had forged her into something stronger. And somewhere out there, another veteran medic was struggling to find their way home. Another surgeon was doubting their worth. Another hero was waiting for someone to recognize their value. Victoria's program would find them, train them, show them that their skills mattered, that their service continued, that excellence born in combat had a place in healing too. She picked up her phone and texted back to Hawkins. "Always forward. Never quit." His response came immediately. "That's my doc. Semper Fi." Victoria smiled. Captain Victoria Ramirez, Navy SEAL combat surgeon, chief of trauma surgery, founder of the National Military Civilian Integration Program. She was exactly where she was meant to be, and the journey was just beginning.